So FreeStyle Libre is a modern way of measuring your glucose. It's a system which measures something called interstitial glucose, which is this fluid around your cells, essentially. Now, it's not quite as accurate as your blood glucose, which is the glucose that flows around your blood circulation and what you normally get when you finger prick. Because it obviously takes a little while for the glucose to go from the bloodstream into the cells. And so there's about a 15-minute delay in the levels equalizing. But it gives you the same trend. So if you know your blood glucose is going up, then your interstitial fluid glucose will go up and vice versa. But it's a very useful system because it enables patients to know at any particular time what their blood glucose is, and then it cycles every 15 minutes, so you can pretty much check every 15 minutes. And as long as you swipe the device, the device is a little device which fits on your arm, the upper arm, and it goes in fairly painlessly underneath the skin and not too far, and sits in a little cannula, sits in the cells, which then measures the glucose levels in the fluid. Now, every time you swipe with either your mobile phone or the little monitor they give you, it'll give you an idea, or it'll give you a reading of the glucose at that particular time. But also it shows you the trend in the glucose, so whether your glucose is going up or whether it's going down or whether it's staying stable, which is a really useful method of knowing where you are with your glucose readings. Now, we know people who've had the Libre and had very little training just improve their glucose just by knowing where they are in terms of their glucose. And most people don't check their finger prick glucose every 15 minutes. So clearly it gives them a lot more warning of what their glucose is doing, but also what their daily life is causing, having an impact on their glucose as well. So I think all in all, that really does help, but it really helps even more if they have a proper education or they know a few little tips and tricks of what to do with the information they're getting. So when the product first came out, there was a real dirge trying to get the government to allow this to be prescribed because they felt it was going to be very expensive. But they soon realized that the benefits it was allowing for our patients. So they then changed their ideas, and the National Institute of Care and Clinical Excellence decided actually it would be a very cost-effective way of managing glucose. So the first group of people they targeted the FreeStyle Libre was the type 1 patients who are clearly requiring insulin, and the majority of whom are requiring a multiple daily dose injection regime where they have to check the blood glucose at least 4 times a day when they're injecting, but preferably more. And they felt that if you were checking your blood glucose at least 8 times a day, then actually the cost benefits of the Libre outweighed the use of test strips. So first of all, it was the type 1 patients who got Libre to play with and use, but actually subsequently NICE have expanded the patient population, and as well as people such as pregnant ladies or people with cystic fibrosis. We're also allowing patients with type 2 diabetes who are on a multiple dose injection regime, or who have difficulty checking their finger prick glucoses, or who are at risk of hypoglycemia. So it's a much broader field these days, but inevitably, I think if you're a type 1 patient, you probably ought to be having a Libre if you want it automatically. So it really helps patients because, as I mentioned before, you're getting access to almost live glucose measurements. So you can see what your glucose is doing almost on a minute-to-minute basis. Now, the Libre, as I said, gives you a reading probably every 15 minutes, but actually it's probably all you really require. But having that information is fantastic because you can see the effects of your lifestyle on your glucose levels. So for instance, when you're eating, you can see blood glucose rising. But ideally, if you've taken insulin prior to that, then you know, it'll stay relatively constant. But the greatest benefit is really from reviewing the data once you've got all the data, and then reviewing it over a slightly longer period of time, such as a week or a month, and then seeing the trends and what's happening. And what we've really found with our patients is that people who are eating, for instance, and seeing a rise in their glucose, you can tell by when they've injected their insulin that they probably haven't injected it soon enough before a meal to counteract that glucose rise. And that's probably the biggest thing that I personally have seen, and I think probably a lot of my colleagues. The difference of seeing that data on a much regular basis compared to blood glucose testing. So this, I think it's really helped patients by enabling us to see that data, and then we can act upon that data according to what they're doing with their lifestyle, and we can make these little changes to try and help people. And as a result, I think we're generally, certainly from our hospital's data, but I know also nationally, we are seeing a great improvement in the marker, the HbA1c marker, which is a marker of diabetes control. The other interesting thing is that, of course, HbA1c in the next 10 years maybe might be outdated, and we might be using something called time in range, which is something which continuous glucose monitoring sensors like the Libre offer, because it gives you a time how long you are within the normal range. And actually, we know from earlier data that HbA1c is a rather rough marker, because it just gives you a rough estimate, and it could be that you've had one really bad day which swings your HbA1c in a negative manner, but the rest of the time you might be very well controlled. So it's not absolutely not exactly a good marker, I would say, but it's a marker we've traditionally used. So, but invariably, I'm sure in the future we'll be using time in range as a much more accurate marker of how well people are doing. And I think that'll tie with complications as well. So we might see a difference in people who have a reasonably tight HbA1c, but have a not so tight time in range, and they may be getting slightly more complications than people who have a similar HbA1c but a much tighter time in range. So, of course, type 1 diabetes is probably the number one condition where it's really beneficial. But I would say also in patients with type 2 who are on multiple dose injections regimes, like NICE have stated. But of course, there are also people who require help to get injections, help to test their blood glucose. So it's in those populations, of course, having an easy access to glucose is very helpful. So, for instance, people in nursing homes. For pregnant ladies, again, who need to have blood glucose tested after an hour after meals, it's incredibly important. And also for people who are prone to hypoglycemia. So very much the NICE criteria are the people who would really benefit from FreeStyle Libre. No, I mean, the only danger is, of course, you're putting in something into your skin through the layer of your skin into cells underneath the skin. So theoretically, you are creating a portal for entry of infections, but it's very rare that we see infections in these patients because it's all covered up. The other thing that I have seen in the past are a few little allergic reactions, but it's more the gel or the glue that sticks the sticky plaster on top of the Libre itself that has caused it. But actually recently, I don't know whether they've changed the constituents of the sticking glue, but it seems that it's a lot less common. But yeah, sort of minor allergic reactions locally and the potential of introducing infection because you're creating a portal underneath the skin. But otherwise, there's very little in the way of side effects.